President Akufo-Addo will this evening address Parliament in what some believe will be his announcement of a decision on calls for a lockdown in the wake of the coronavirus spread. Now, this afternoon, Ghana's confirmed cases have increased by 4 to bring the total cases to 164 infections since the outbreak 2 weeks ago. We're going to be joined shortly by the head of our health desk for details of the new cases. First, though, let's turn our attention to events at the health facilities that are managing this situation. A number of them have made public appeals for support as they are running out of essential logistics. The 37 Military Hospital, the Greater Accra Regional Hospital, are but a couple of the facilities that have gone public with their plight. Listen to the medical director at Ridge Hospital, Dr. Emmanuel Slorfenyo, and the commander for the 37 Military Hospital, Brigadier General Ni Aja Obudai.
How many patients are you currently?
Our center currently, we have 4 of the patients under our care.
Okay. And this has been the case since they were brought? The same patients since they were?
Yes, you know, first we started with 1, and then it went to 2, and eventually the 4th patient was transferred to our center. So that is the situation. We have not discharged any of them yet because we are waiting for their final lab results. They are generally doing well, and we are waiting for their final lab results. And as and when the results come and everything is fine, they will be discharged home.
Do you know when the results will come in?
Now the testing centers are a bit overwhelmed, and so some of the results sometimes delays a little. So I cannot predict when the results will come in. But I do know that once the results come and everything is fine, they will be discharged.
We have 136 cases right now. It means that we will need more space to handle them. Would you recommend, with your facility being one of the foremost facilities for this management of this, would you recommend expansion or conversion of some of your facilities into holding rooms for this purpose?
The thing is that it is not in terms of, because of the highly infectious nature of this condition, it is not generally advisable to combine those patients with other categories of patients in the same facility. So luckily, by the design of our place, our holding center is away from this main facility. So this is where we look after routine staffs, routine patients who have other conditions, and then those who have been confirmed are also looked after on the other side. It behoves on government and our leaders to take the final decision, but when they are mixed together in the same facility, it may not augur well, but we leave the final decision to government.
But is there a need to expand facilities there to be able to deal with the matter?
Yes, there is the need. There is definitely the need. What is happening is that for us, we are talking here now, we do know that there is one new facility that has not been that is about to be operationalized. Government has taken a decision that that facility will be used solely now for these cases, and that's the Ghana East Hospital. And that's a new hospital, about 100-bed capacity. So that hospital now is at our disposal to be used solely for this condition, and the hospital will revert to regular use after this epidemic is over. Greater Accra Regional Hospital, to express my sincere thanks to this gesture. Really, we've received a couple of donations, but the particular things that really has been a challenge to us has been the disposable gowns, because, you know, before the staffs will prepare themselves and then enter where the patients are, they have to be in these outfits. And you know, you wear these outfits only once at a time, and once you wear, you discard. So it means that the usage is very high, you know, and so it's been a big drain and on our own resources and also on the resources of the government. And it is in this respect that we are so grateful that you've made this presentation and you made this donation to us. We can only assure you that we'll put them to good use. We will make sure that they are not abused, they are used the way they are expected to be used. We also want to use this opportunity to thank the general public, those who have supported us already, but we are asking for more support, because this is a fight that we are fighting together. It is either we fight and win together, or we lose it together.
Initiatives, okay? So we have done that to at least augment what is going on. So up until now, that's what we have done. We still need inputs to get things going, okay, by way of personal protective equipment, all the things that go with it, sanitizers, whatever. We need all inputs to get things going. For the nature of what we're dealing with, it is a public health department that is actually on call. Because it's a public health emergency, it's a pandemic, okay? So it's a public health specialist, public health physicians with all their attendants, disease control, surveillance. It is a public health issue. So broadly speaking, it's public health. But of course, they don't work alone. All the departments come into play, medical typically, division of medical come into play. All of us are also in play, standing in order and in line as the duties come on. So we are so it's not like public health and they are alone in the business. We're all on ground working together to get the things sorted.